first piece of that pyramid is repetitive stress injuries. And a repetitive stress injury is an injury that's caused by or aggravated by a repetitive work activity. And typically what we think of when we think about a work injury is we think about guys working on the Bay Bridge right out there and they drop something on their foot, or they're lifting something heavy and they strain their back. So what they did is they invented those elastic bands that guys put around. So if you've been to a Costco or a Lowe's, you'll see those guys with the elastic girdles, and they put those on. And what those are designed to do is to stabilize your back and hold your back in a good neutral posture. And so if I had to lift this desk and I had one of those things on, I'd walk over and I'd stop and I'd put my little girdle on and go, wait a sec, I can't lift that. And then I'd go get some help or a forklift and lift it up and move it, right? And so blue collar injuries are actually falling, but where injuries are rising are in white collar jobs where people are sitting for hours and hours. And so what happens is you're sitting in these cramped positions or these awkward postures, and your body will tend to break down. And those are repetitive stress injuries. So it's just doing the same action over and over, and your body tends to break down. There's three major ways that your body breaks down, and those are muscle fatigue, nerve entrapment, and tendonitis. Okay, and so you may be familiar with some of the diagnosis like muscle strain, trigger points, that sort of thing, tension, shoulder tension, things like that, and those are caused by muscle fatigue. The way your muscles work, they're these little bands of fiber, and when you contract a muscle, they just slide past each other, just like that. And you can feel this if you put your hand on your bicep and make a muscle like this. What you're gonna feel is the muscle bulk up. You're feeling those fibers just slide past each other, okay? If you hold a muscle in a contracted position for a long period of time, what happens is you cut off the oxygen supply, and that tissue becomes ischemic. That just means lack of oxygen. But if the tissue becomes ischemic, it can't relax, it gets stuck. And what happens is it actually gets tighter and tighter. And over a long period of time, these fibers will actually scar together. And if that happens, they will create a trigger point or a knot. And you can feel this. So if you take one hand, put it right up here at the corner of your shoulder blade, kind of at the base of your neck, and rub back and forth, you'll feel a knot or a tight spot. And what that is a muscle that goes from your shoulder blade to the base of your skull and keeps your head from falling forward. So if you're sitting in a slouched posture trying to hold your head up all day, you're firing that muscle, and it just gets tighter and tighter, and it gets stuck. And that becomes important because if you can't relax the muscle, it changes the biomechanics of the joints around it. And so when you change the biomechanics of the joints, that can cause injury. And you can feel this. So if you shrug your shoulders up like this, become a no-neck person, and then try and lift your arms up, this is in a way, but if you lift your arms up, they don't go very far, okay? Then if you relax your shoulders, kind of roll them for a second, drop them down, put your arms out to the side, and lift up, your arms will move very easily. And so you can see if those muscles are tight, it changes the mechanics of the joints around it, and that can lead to injury. It's not only, it is. Staying in those contracted positions will put stress on your body. And what we see a lot of times is people will lean out on the desk, or their arm rests are way up here and they're working like this, and they think, oh, I'm supporting my arm. But what you're doing is you're holding that muscle in a contracted position, and it's called adaptive shortening. If a muscle's held in a shortened position for a long period of time, it will grow shorter and shorter. So you can't relax your shoulders, you can't move, and that can lead to injury. And that is muscle fatigue. The next major cause of cumulative trauma disorders is nerve entrapment. And nerves are the connecting lines between your brain and your body. And they're a lot like surgical tubing, okay? And the way that they're similar is they're round, but they're also stretchy. A nerve will stretch up to 30% of its length, okay? But after about 8%, it gets ischemic. So it too will lose its oxygen supply. And you may have noticed this if your mouse tends to migrate away from you across the desk and you're reaching out throughout the day, or if you're leaning on something and sitting for a while waiting for something to download and you notice you're getting a little bit of numbness and tingling, what's happening is you're putting tension on that nerve and you're cutting off the oxygen supply. So there's three major nerves that run from your brain down into your hand, and what they do is they run through these muscles right here on the side of your neck. They run underneath your collarbone, but above your first rib. So there's a little gap right here. They split into thirds and they drop down into your hand. And so the three nerves are the median, the radial, and the ulnar nerve. And so you can feel these. So if you scoot out to the edge of your chair, relax your shoulders, turn your palms out away from you, bring your fingers back, and then reach back gently. And as you do that, you'll start to feel it pull down your arm and into your fingers. And then very gently drop your head to one side or the other, and you'll feel just a little bit more pull. And what you're doing there is you're pulling that nerve all the way down the track, and then as you move your head, you're adding just a little bit more tension. So what you're doing is stretching that nerve. Okay? And that's the median nerve, comes into your thumb and first two fingers. The next one is the radial nerve. It wraps around the back of your arm into the back of the hand. To feel this one, relax your shoulders again. This time curl your palms inward, curl up your fingers, and reach back gently. And what you're gonna feel is a pull into the back of your hand, back of your forearm here. Once you feel that, very gently, just drop your head to the side. And there you'll feel a little bit more tilt, or more pull. And then when you bring your head back up, it'll go away, okay? So radial nerve runs into the back of your hand. The last nerve is the ulnar nerve. Comes down on the inside of your arm, right through here. This is called your ulnar groove, that bump on the inside of your elbow. Runs right through here, and then down up into your ring finger and your pinky finger, right there. To feel this one, relax your shoulders again. Bring your hand up like this, like you're holding a plate of food, like you're a bus boy or bus girl or bus person, I suppose. Just depress your shoulder, just bring your shoulder down a little bit, and I start to feel it right there. But if you don't, or if you want to feel a little more, just bring your elbow out away from your body, and what you're doing is pulling that nerve around the ulnar groove up into your pinky finger up here, and so you'll feel that tension all the way along the line, okay? And that's your ulnar nerve. That's the one when they do that Tommy John surgery, like they're doing with Brian Wilson of the Giants over here. That's what they do. They take the nerve and they actually move it. They take it out of that groove and put it here, because when you pitch, it puts a lot of stress right through here. Okay. Hopefully, you won't have that much stress here in the office, but that's what they do. The thing about nerves is they're very sensitive. They don't like being compressed. They don't like being stretched. So it's very important that you bring things in close, so when you're working, you're not putting a lot of tension on those nerves. Okay. The last major cause of cumulative trauma disorders is tendonitis. Okay. Tendons are a lot like this piece of rope. Basically, it's a very strong, very dense material, and what it does is it connects muscle to bone. So when you contract a muscle like this, it pulls on the tendon, it brings the bones closer together. And you can actually see these. So I want you to pretend that you're a Scottish dancer for a minute, and what they do when the Scots dance, they do this. When the Irish dance, they have the good sense to keep their hands down, but when the Scots dance, they do this. And this is called a stag's head. And so just pinch your middle two fingers together with your thumb. And then look at your wrist, just about where your watch band is, and tip the stag's head, tip his nose forward just a little bit, and look at where your watch band would be, and you'll see these little bands of tissue popping up. And those are tendons, okay? Those connect the muscle to the bone. And again, they're a lot like this piece of rope, okay? Very strong, very dense material. What happens is typically when you move, if you're in a good neutral posture, the tendon just slides like this. It's a frictionless situation. If you're leaning on your wrists, or if you're reaching way out for the mouse, you tend to bring the bones closer together and you pinch the tendon in there. So instead of sliding like this, it slides on the edge like this. And if I did this desk might be a little bit better. So instead of sliding like this, where it's pretty much frictionless, it starts to slide like this on that edge, okay, like that. And what that does is it will start to irritate this, and if I did that long enough, it would fray, kind of like this. And that's what happens in your body. And that when that frays and that becomes swollen, that is tendonitis. So if you've ever had tendonitis, it's an irritation of that tendon, okay? So again, it's very important that you bring things in close so you're not compressing those tendons or putting extra stress there. So that is tendonitis. Usually we see that in the elbow or the wrist, usually in the back of the wrist here or in the elbow here. And the reason is because the keyboard is in the wrong position and your wrists are in a more extended position and you're overusing these muscles here. You can actually feel that if you take one hand and wrap it around just below your elbow joint, okay? Hold your wrist straight and then kind of feel the muscles they're not working too hard. Bring your fingers up towards the ceiling. You can feel how these muscles are working really hard. Bring your hand down towards the floor. You can feel how the muscles on the other side are working really hard. So that's why it's important to keep your wrists straight so that you minimize the stress on those muscles. Because if you're pulling on the tendon all the time here by holding your wrist back, you're pulling on this rope and it will start to fray. And when it frays on the outside of your elbow, that is tennis elbow. So we see a lot of people with the diagnosis of tennis elbow that don't play tennis at all. It's because they're working with their wrists in this really extended position. So it's important that when we set up the workstation, we get you in those neutral postures to minimize that stress. Now, all of these things come together in carpal tunnel syndrome. Carpal tunnel syndrome is the most diagnosed repetitive stress injury, and almost everybody thinks that they have it. And my brother, every time I see him, he goes, "Oh, my carpal tunnel's acting up." I'm like, "Really? Where does it hurt?" And he goes, "Oh, it's killing me right here." And it's like, well, that's not really your carpal tunnel at all. Your carpal tunnel is actually your wrist. Okay, so the way your wrist is built, there's 8 bones right here, and you can feel these if you go to your pinky finger right here. And then come down right to the corner of your hand, you'll feel a bump. And then if you relax your hand, you can actually grab that and wiggle it back and forth. That's called the pisiform bone right there, okay? That's one of the 8 bones that form the carpal tunnel. And what they do is they form a cup like this, and then across the top there's a ligament. And that's the top of the tunnel. In that tunnel are all the tendons that move your fingers. And then the median nerve runs just on the thumb side. The ulnar nerve runs just on the pisiform side right here next to that bone we were playing with. So the ulnar nerve runs here just on top of that tunnel. Okay? And what that looks like is this. So here's your hand without the skin. So your carpal tunnel is the wrist right here. When we were doing the stag's head, this is the tendon that you were looking at right here. And when you pinch your fingers together, this will poke out just a little bit. If we pull that back, you can see the actual carpal tunnel. This is the pisiform bone right here. That's that first bone we were feeling right on the corner of your hand. Just on the inside of that, this green structure is the ulnar nerve. And that runs into your pinky and little finger, these two right here. Next to that, you have the flexor retinaculum. This is actually a ligament that holds it's the top of the carpal tunnel. It holds everything in. These blue structures right here are the tendons. And what those do is those move your fingers. So when you contract the muscles of your forearm, it pulls on these tendons and that brings the fingers down. Just on the side of that is this yellow structure right here, and that is the median nerve. It comes into your thumb and first 2 fingers right here. And that gives it strength, it gives it movement, and that. So what happens in carpal tunnel is you overuse the muscles of the forearm. That then puts tension on these tendons right in here. They become irritated and they swell. And when they swell, it increases the pressure within that tunnel, presses on that nerve right here, and that then causes numbness and tingling in these fingers right here. And so what you'll see is if you go to the local grocery store, a lot of times the clerks will be wearing those braces on their wrist. The idea is to keep their wrist straight so they're not extending it, they're not putting pressure on this nerve here. But what we actually see much more of is called Guyan's tunnel syndrome. And what that is compression of the ulnar nerve right here. And the reason we see so much more of that is because when you start reaching out for the mouse, you tend to supinate and extend your wrist. And when you do that, you expose this bone right here. And then as you start to reach, you tend to plant. And when you plant right on the corner of your hand here. And that's where that bone is. And we know, because we played with it, that bone moves. So if you grab here, remember, you can move this back and forth. You can move that bone. But if you're putting pressure here on that bone, it then slides in. It will compress this ulnar nerve right here. So people will come to us and say, I have numbness and tingling in my ring finger and my little finger. I think it's carpal tunnel. And really what they have is compression of the ulnar nerve right here on the side. So again, it's really important that when we're setting up the workstation, we bring everything in nice and close so we're not doing a lot of reaching and not putting a lot of pressure here on the corner of the hand. In the office, what we want to make sure we're doing is we're keeping the wrist straight and working so that our wrist isn't extended, so we're not putting pressure into that tunnel. The other thing that we see a lot of is back pain. So a lot of people, their chief complaint is that their back hurts. And so that typically is a result of not having the chair set correctly, and we're going to talk about that in the next section on the biomechanics of work. But what happens is when somebody's slumped in their chair and sitting like this, it's the same sort of thing. They're putting their body in an awkward posture, then they overuse these muscles here in their low back so that these get stretched. You stretch out the ligaments down there. You put more stress on the discs, which are between the vertebrae, and we'll show you what those are. But you put more stress on the discs, more stress on the ligaments, but also the nerve roots that run down into your legs. So if you're sitting in these slumped postures, that can put a lot of stress on your back and cause back pain. So it's very important, again, that you set up the chair to hold you in a neutral posture, and then that you set up the rest of the workstation to maintain those neutral postures as well. So what I'd like to do is talk to you about the biomechanics of work and how to sit in a neutral posture. And all of the pathologies that we talked about, the repetitive stress injuries, the muscle fatigue, the nerve entrapment, and the tendonitis, are all related to the way that you sit and the way that you use your body. If you're using your body in a non-neutral posture, if you're sitting in a slumped posture like this, there's no support for your body, so the muscles have to work harder. There's more tension on the tendons to try and hold you up. There's more stress on the nerves because they're getting pulled where they're not normally supposed to go, and there's more compression. So it's really important that when you're working, you're sitting in a good neutral posture where the weight of your body is balanced through your spine and held in a position that minimizes the amount of muscular work that you have to do, and that will minimize the stress on the tendons and the nerves. Now, to sit in a neutral posture, and I'm sure you've heard this your whole life, sit up straight, you're slumping, sit up straight. My mom used to always yell at me, and it was really her fault because she bought furniture that didn't hold me in a neutral posture. Everything held me in this posture. So really, it was her fault I wasn't sitting up straight, not mine. But to sit in a good neutral posture, you really have to understand how you're built and how the body works. So to do that, I have one of these, and this is a spine. You should have one of these. Everybody should have a spine, not necessarily a spine model though. So the way that you're built is you have a pelvis down here. It's made up of two ilium and a sacrum, which is the bone in the back. And you can feel this. So if you take one hand, put it at about belt level, push in a little bit, you'll feel this big ridge of bone right there. And what you're feeling is this is called the iliac crest, but you're feeling part of your pelvis right there. On top of the pelvis, you have the vertebrae. You have 5 lumbar down here at the base. You have 12 thoracic, which are in the middle where your ribs are, and then 7 cervical up here, which is your neck, and then your head fits right up here on the very top. So this is a vertebrae, and you can see that this is the body, this big chunk, this is the big solid chunk of bone, holds 80% of your weight when you're standing or sitting. In the back, you have what's called a spinous process, which is just a little projection that muscles attach to, and then 2 transverse processes. And what these are just muscle attachment sites. And so these just poke out, and then muscles attach here. And you can feel these if you take one hand, put it right in the center of your back, and you'll feel those little bumps. And those are just these spinous processes. Those are just part of the spine. And then actually, if you bend forward, you'll feel those get further apart, and if you bend back, you'll feel them get closer together. And that's just your spine moving. Then underneath the spinous process, you have the facet joints right here. And what those do is those hold the other 20% of your weight when you're standing or sitting. And they also limit your movement. So when you go to turn, they bump into each other and they limit your movement. Otherwise, you'd be a cartoon person, right? Somebody would call your name and your head would just spin around and around. Then between each vertebrae, you have a disc, and the disc does a couple things. It acts as a shock absorber, so when you're walking, you're not banging bone on bone. but it also acts as a spacer. So it maintains the distance between the vertebrae so that these nerve roots can pass through. So when we were doing the demonstration earlier and we were feeling the nerves that run down into our hands, we were stretching the nerve roots up here in our necks. Down here in your low back, you have another set of nerves that come out and form this big green chunk right here, and this is your sciatic nerve. So the bottom nerve roots here come out, form this big cable that runs through the muscles in your butt and come down into your leg. So if you've ever had sciatica or known somebody with sciatica, a lot of times what that can be is compression of the nerve roots here, and that causes pain running down into your foot or leg. Okay. Now the disc is a lot like a soy sauce package. And the way that it's similar is that it has this hard packaging around the outside, but inside it's a gel-like material that actually moves. So when you put pressure on the front of the disc, it pushes the fluid back. When you lean back, you put pressure on the back of the disc and the fluid comes forward. And the reason that is so important is because if this was solid, your spine would be a pole, right? You wouldn't be able to move. But since this is fluid and moves, when you bend forward, you put pressure here, that fluid moves back, creating space for you to move. When you bend back, same thing the other direction. So when you bend back, that fluid comes forward, creates space for you to move. Where this becomes a problem is if you're sitting in a slumped posture and putting pressure on the front part of the disc for a long period of time, what happens is this packaging will start to give way. And maybe you've done that as a kid where you put this under a car tire and somebody drives over it and it pops, right? And it squirts the car next to you, and then you laugh and run like hell. The same thing can happen in your back. Usually not quite so violently, but if you're sitting in a slumped position for a long period of time, putting pressure on the front of the disc, you're putting pressure, that fluid's pushing back on the back packaging here, and over time that gives way. And when that gives way, it causes a slip disc or a herniated disc or a bulging disc. And what that is just this inner material is coming out and will push into the nerve roots here in your low back. When these nerve roots become compressed, just like the numbness and tingling we feel in our hand when we're putting pressure on the nerve, it will cause numbness and tingling coming down into your leg. So when you sit, you want to sit in a position where your body is balanced over your pelvis, and so the spine will line up on top of itself, kind of like this. Now that's very difficult to do because most chairs are not designed to hold you in that position. Most chairs are designed to be stacked and moved. They're not designed with your biomechanics in mind. So what most chairs do, think about your couch or your car seat or a conference room chair, what they do is they bring your knees slightly above your hips. And so your leg bones here, as your leg comes up, it pulls on the hamstrings, which are the muscles in the back of your leg. It pulls your pelvis underneath you and you tend to sit on the sacrum like this. Then your lumbar spine gets pulled forward like this. Your thoracic spine comes forward as well. So your spine comes into this big C shape. Then to keep your head level, you have to do that with your cervical spine. So you're kind of in this slumpy posture, this big C. And in that position, your back can't hold any weight. So if I push here, it just gives way. So then to hold your body up, you have to use all the muscles of your back to try and hold you up. And that's going to increase muscle tension. It's going to pull on the nerves. It's going to pull on those tendons and just increase stress in general. So what you want to do when you're sitting is just the opposite. You want to get your knees down below your hips so your pelvis rolls forward so that you get off of the sacrum and onto these bumps here. These are called the ischial tuberosities. But you want to get onto those bumps in your butt to roll your hips forward. When that happens, your lumbar spine comes forward into a more neutral position like this. Your thoracic spine straightens out, okay? So you sit taller, as does your cervical spine. And in this position, this guy's seen better days, but I can push on this pretty hard, and in that position, it will hold the weight because the bones are lined up to be anatomically correct in a neutral posture. Okay, so when you're sitting, you want to position yourself so you're in this neutral posture. Okay, so that's what it looks like biomechanically. You can also feel the difference. So if you look over the side of your chair and find the height lever, and lower the chair down as low as it will go, okay? And then put your feet on the casters here. So so that your knees are a little bit above your hips, and then scoot forward just a little bit in the chair if you can, and then let your pelvis roll back and just slump into the chair like that. Okay, just like you're at work, normal day. So you sit like that for a second, and in that position, try and take a deep breath. It's actually kind of hard to do, and the reason is because your ribs wrap around from your back to your sternum here. If you're in this position, they can't expand, they can't move to get oxygen into your lungs. The other thing is, in that position, it's hard to move your shoulders because your shoulders roll forward on the rib cage. The whole shoulder girdle comes forward, and in that position, it's very difficult to move your arms. So in this position, if you put your arms out to the side and try and lift your arms up over your head, they don't go very far, and it's because your shoulder's in a really awkward position. The other thing is, it's harder to move your body. So you're also not as strong in that position. Okay. So really, what you want to do is you want to sit with your hips above your knees. So again, find the height control. Raise the chair up so that your hips are above your knees. And what that does is it puts slack on your hamstrings here. It allows your pelvis to roll forward, so your spine comes into that more neutral posture, allows your thoracic spine to straighten up and your cervical spine to straighten up, but it also allows you to breathe. And you can feel this. So if you've raised your chair up, now if you take a deep breath and let it out, it sounds like you're doing yoga, right? Because now you're getting much more oxygen in there. These ribs can expand. You get more oxygen into your lungs, more oxygen to the tissue. If you put your arms out to the side and raise your arms up, they'll raise up much easier now because your shoulder has moved from this position into this position, and there's plenty of room for it to move up and over your head. So when you're positioning the chair and your workstation, you want to keep that in mind. You want to sit in a good neutral posture, and the key to sitting in a neutral posture is bringing your hips up above your knees so your pelvis rolls forward, so that you can balance over your pelvis. And then we'll set up the rest of the workstation to hold you in that neutral posture. But the first thing is to think about your spine, get that in a neutral posture. Beyond that, then, we want to think about the rest of your body. So ideally, your head should be balanced over your shoulders so you're not looking down or up. Because when you do that, when you look down, this is your head. When you look down, you flex all of these vertebrae here. That puts a lot of tension on these muscles here. So you're trying to fight your way up, keeping your head up. It can pull on the nerve roots here a little bit. The other thing is, if you're looking up a lot, it's just the opposite. So what happens is you close down these little joints, you can pinch these nerves here, and that can cause numbness down into your hand. So again, it's important that your head is balanced over your shoulder and your neck is straight so that you're not looking up and down. So you're minimizing the stress on the structures in your neck here. Your shoulders should be relaxed at your side. So we see a lot of people that are working with their arms way out here. I call it the modified Frankenstein. And so they're working like this, okay? The problem with that is when you reach up, you increase the tension on all the muscles of your shoulders, and you can feel this. So if your shoulder's relaxed, put one hand up here on your trapezius, the muscle right here, right there, and then just lift your arm up, and you can feel how hard that muscle has to work to hold your arm up. So when you're working, you want to have your shoulder relaxed at your side to minimize the stress on these muscles up here in your neck. With the elbow, ideally it would be straight, but you can't type like that. So what you want to do is relax your shoulders, have them at your side so they're not flayed out, they're just kind of comfortably at your side, not reaching forward. Bend your elbows about 90 degrees. And what you can feel is as your hands start coming up, you start using these biceps more, and also you'll start to elevate your shoulders more. So you want to relax your shoulders, bring your elbows to about 90 degrees so that your biceps are relatively relaxed, as are your shoulder muscles. With the wrist, you want to make sure that your wrist is straight, because if your wrist is extended or flexed, you're going to increase the amount of work that these muscles in your forearm have to do. And remember, we did this earlier, but we can do it again. Just grab your elbow here, bring your fingers up or down. You can feel how hard those muscles have to work. So it's important that you keep your wrist straight. And this will become important when we set up the workstation itself. We'll show you how to tilt the keyboard tray to keep that wrist straight. But the real take-home message is keep your wrist straight. because if it's extended or flexed, you start to increase the amount of work that these muscles have to do. The other thing that happens is when you extend or flex your wrist more than about 15 degrees, which isn't very far, you start to increase the pressure in that carpal tunnel and can pinch those nerves that run through there. So again, it's really important that you keep the wrist straight. The other thing, and I just saw a colleague the other day when I was coming into the city here, and we were talking about your hamstrings, and I hate to see her because she's always telling me to sit up straight, but what happens is people will sit like this with their feet behind them, kind of perched on the edge of the chair. In that position, you're shortening your hamstrings. They're about as short as they can be, and they get tighter and tighter, and then when you go to stand up, you can't stand up fully. It can lead to strain and that sort of thing. So it's important that when you're sitting, your feet are on the floor, but your feet are in front of you slightly so that you're stretching out these hamstrings, not holding them in that contracted position. Because remember, if you hold a muscle in a contracted position for a long period of time, it can become ischemic, it can cause those trigger points, it can cause adaptive shortening, and that will change the mechanics of both the knee and the hip. But it can also then cut off circulation to the nerves as well. So it's important that when you're sitting, your feet are slightly in front of you and on the floor so that you're keeping those muscles in a nice stretched out position. And that is a neutral sitting posture with your feet solidly on the floor, knees slightly below your hips so that your pelvis rolls forward, and that allows your lumbar spine to straighten out, allows your thoracic spine to straighten, and then allows your cervical spine to be balanced over your shoulders. Then you bend your elbows about 90 degrees, somewhere in there, with your shoulders at your side so you're not reaching out or forward. So your shoulders are relaxed, elbows about 90 degrees, wrists straight. And that is a neutral sitting posture. So with sitting, the thing is that even if you're in this good neutral posture, it's really easy to slump. And over time, you just get tired. It will show you how to set up the chair to promote this neutral posture, but you tend to get tired and slump. And when you do that, you put a lot of stress on your lumbar spine and your lower back. So the trend in ergonomics is really to stand in the workstation. And so we see a lot of people that want to stand and work in the workstation. And the idea is good, and it changes your biomechanics. So I wanted to show you a little bit about how to stand in the workstation in a good neutral posture, because moving from one position to the other, it's less stressful in some ways, but it can be more stressful in others. So you want to do it correctly to minimize that stress and stay in those neutral postures. So when you're sitting, remember, what happens is you tend to sacral sit, you tend to roll back, you tend to flex your lumbar spine, and that puts pressure on the discs and the muscles and the ligaments here. When you're standing, what happens is there's less tension on the hamstrings and the pelvis will tend to roll forward. When you roll forward, your spine will tend to come into this more neutral posture. The problem is that when you're standing, because we sit most of the time, when you stand, these muscles here are typically very tight. So when you stand, your hip flexors, the muscles that run from the front of your spine to the top of your hips, they tend to pull your pelvis forward. So instead of slumping where it's going back, now it's coming forward. And if your pelvis rolls forward, you tend to increase, it's called lordosis, but the arch in your low back. And what that looks like biomechanically is this. So the muscles run right along the side of your lumbar spine here, down like this to your femur right here. So they come up and down like that. If you're sitting for a long period of time, those muscles get very tight. And then when you stand, what they do is, since your pelvis is going this way, it tends to pull your lumbar spine forwards. And if you go too far, what can happen is you tend to put pressure then on these nerves here. And that can cause pain and numbness and tingling down into the leg. So the other thing is, it's very hard to maintain that neutral posture, because if you're wearing heels, that will bring you up onto your toes. Even small heels, like on my shoe, it'll tend to put me forward. If you're slightly overweight, that will tend to pull you forward as well. And so to balance, since your center of gravity is in front of your body, what happens is you start arching your back even more and potentially compressing those nerves in your lumbar spine. So what you want to do when you're standing is get a binder or a ream of paper, something like this, put it on the floor here, and put one foot up slightly. Okay, and that does a couple things. By bringing one foot up, it tends to tuck your pelvis under you slightly, keeping your spine in a more neutral position, more balanced. Your weight is now balanced between your 2 feet, and you can rock back and forth if you want. That gives you some hydration in the discs, but keeps you moving. But it allows you to stand straighter and bring things up. So it takes away the tension on the muscles here in that really arched position. It puts your back in a much more neutral position and more balanced. So when you're standing, it can be less stressful than sitting, but you just want to make sure that you're standing in a position where your spine is neutral, and the easiest way to do that is to just support one foot so that you're balanced like this.